Welcome back to the Pioneers in Aged Care podcast. Here we have Daniel Waldron, the General Manager of Strategy and Business General Manager of Strategy and Business Improvement at Mercy Health. Thank you so much, Daniel, for being on the podcast.
Thank you for the invitation. It's lovely to be here.
And I'm really happy to have you on because your area, what you do, something that I've got no idea about, but I'm keen to pick your brain on it. But why don't we start off with firstly getting an understanding as to who Mercy Health is?
Yeah, absolutely. So Mercy Health, we're a national health services and healthy ageing provider. So we've got a number of public hospitals down in Victoria and then subacute and communities health services throughout New South Wales and Victoria as well. And then we've got a healthy ageing business, which is the part of the business that I work in. So we've got home care and community transport. We've got retirement villages and assisted living. And then we've got residential aged care. So we've got 30 residential aged care homes all around the country.
In every, are there any states that you don't have a presence?
So the states that we are in are WA, Queensland, New South Wales, and Victoria. And we also do some work in ACT as well.
Okay. Any, I was going to ask this later, but any future plans to expand into, which states aren't you in at the moment?
So we're not in Northern Territory, South Australia, and Tasmania.
Okay. Is that in the pipeline or?
We've looked at it when we set our strategy last year.
Yep.
And we have some ideas around when we might consider it, but it's on the list. It's probably not at the top of the list right now. I think there's enough opportunity in the other states that we're already in.
Yeah.
And I think through it's easier to have scale in the business that we're in.
What percentage is Mercy Health, the aged care side versus the acute hospital side?
About 50-50.
All right, okay.
Yep. Yeah, so we've got 10,000 staff nationally.
Are you guys the only organisation that services both?
No, there's lots of other organisations that do both. Calvary's a good example, St. Bede's. There's a lot of Catholic providers, so Mercy Health, a Catholic not-for-profit organisation. So there's a number of us and others as well that do both.
Okay. Now, tell me, what do you do? What is that job title of yours? It actually sounds, for me, it sounds intimidating. But tell me what you do.
Yeah, it's a big and exciting role. So the first part, strategy. So my role is so I've been at Mercy for 18 months. So I spent the first year, last year, getting to know our business, getting to know our people, getting to know the board and getting to know all the different things that make up the business and working out what we're good at and maybe the things that we had opportunities to improve in. And basically spent the better part of last year working with all those groups in the different parts of the business to work out where do we want to be in the future? What are the things that we're really good at that we want to keep doing and be really well known for? And then what are the things that maybe aren't as good, because they're important, because if they're problems, then we want to fix those as well. So working through and creating a strategy for the organisation for the future so that we can then go and deliver against and measure ourselves from a success standpoint against. So that's the first part. The next part then is the business improvement, and that's actually quite broad. What I would talk about from a business improvement sense is obviously the improvement element, so improving things in the improvement science side, but there's also the broader transformation and project and program delivery. We've got a pretty active growth agenda, so we do mergers and acquisitions, so I look after the integration of those, and really it's a very deliberate choice in my, at the time, newly created role to bring the strategy component together with the execution and the delivery all into one team, so that we can make sure that when we go and do and deliver new projects, that it's aligned to our strategy and it's making sure that we're progressing towards the strategy that we agreed on that we were going to achieve over time.
How hard is that? Because the strategy side, you've done all the research, you've gathered all the data and say, this is what we need to do. But then implementing and executing when everyone's already got a million things that they need to prioritize, how hard is it in general, not just at Mercy Health, to really lead them down the path that you need to go?
It's really hard. Implementing is really hard. The thing that a lot of organisations, so I was a consultant prior to starting at Mercy Health, and I did strategy consulting. So I would go and work with organisations and help them create their strategy, and I'd walk out the door and leave. And often what would happen is I then go and check in on them after a period of time, and this beautiful PowerPoint, really pretty slides, lived in a drawer and nothing happened. And the execution part is the really hard bit.
Yeah.
And that's why in my role, we've brought the people that are responsible for overseeing the delivery and execution all into one team, right? And we constantly reference the strategy as the why we're doing this project. It is really hard, right? Because the thing that often we forget is that we actually do have a daily business to run, right? You go into an aged care home, or you go and speak to the team, the service coordinators in our home care business. They've got clients, they've got staff, they've got day jobs, right? And then we're going to go and try and implement new systems, right? We're going to go and train them and get them to do the next cool thing. It's really hard to prioritize and find time.
I know a fair few people at Mercy Health. They've always said, they've always been very positive, and they've always been happy about where their career is going, because there is always forward movement. So when you're trying to implement and execute, what's the experience been at Mercy Health? Have they been quite receptive?
Yeah, I love working at Mercy Health. Honestly, I really genuinely do. The people are amazing. And I think we've got a really good culture in our healthy aging business. We've got a really connected and strong leadership team. It's quite a new team over the last 18 months. And we've all come on board together at the right time and gelled. And it was perfect, right? Because we worked together to create our strategy and agree on what we want to do for the future. And we've brought each other and the business then on that journey, and we're starting to show progress around delivery and executing against that. And I think the broader business and our teams really resonate with that, because they see our leadership team working together to deliver these. They can see us walking the walk, not just talking the talk, and people are more than willing and excited that when the cool piece of software comes on board, or the new training that we've got to do for the improved quality standards, right? All of these things come on board, and people are excited because they know what we're working towards now. We're not just coming to work to go to work today. We know where we're going.
And talk me through your journey into aged care.
Yeah, absolutely. So as I mentioned before, prior to this, I worked in consulting. So I worked at Accenture, and I was the health strategy lead across Australia and New Zealand.
You were what, sorry?
The health strategy lead across Australia and New Zealand. So I worked with private health insurers, private hospital groups, public health systems, and also aged care providers.
So Mercy Health picked up a pretty good GM of business and strategy, because Accenture it's not a small company.
No, it's thank you. It's a 700 and something thousand employee organisation around the world. It's mammoth. It's huge, and I learnt a lot there, and I loved my time there. And I do look back fondly on all the skills that I learnt, and the relationships and the people that I met. And I think it really set me up. The reason why, to go back to your question, how did I end up in aged care? I was in a regional role. I spent most of 2023 living in New Zealand, because it was over there doing a really big piece of work for a big client over there. I still had responsibilities in Australia, and I still had a life and family and friends in Australia. And so I did, I think, over 100 flights in 2023.
Oh, wow.
And I was just physically and mentally exhausted. It was just that. And I'm a bit of a workaholic. I love work, I love my job. And I realised that I needed to remove myself from a consulting style organisation. You know, the consulting organisations, it's a two-way street, but consulting organisations, in my view, they'll take everything they can from their team. It's probably not that surprising for someone to hear, particularly with a background in recruitment.
Yep.
But I realised I needed to remove myself from that environment and that dynamic and move back to my terms. And I was ready to move into a role where I had quite a lot of breadth. And was going to be able to have quite a lot of impact, and with where we're at as a country with an ageing population, and finding an organisation that was aligned with my values was something that was really important to me, and aged care just felt like the perfect fit. I kind of played around the edges and done a little bit of work with some aged care providers, but hadn't formally worked for an aged care provider. So yeah, it was just fortuitous. It was great timing for the role to pop up, and here we are. As I say, the rest's history.
And this is why I'm excited about the future of aged care. We're getting people like yourself with the backgrounds that you have, bringing all your expertise and experience into an industry that really needs it. And it's at a turning point where they're very accepting of change. The industry is very accepting of change. It has been pretty slow moving in the past, but I think I personally feel like with COVID, and I don't know if I should say the term, but hitting rock bottom, when at the time everyone's said enough is enough, and we're going to move forward now, and we've got people like yourself pushing forward.
Excuse me. Yeah, it's 100%. I think there's a large number of people that are so dedicated, both what I'd call lifers, people that have worked in aged care forever, and people that are maybe newer to the industry like me. And I find it really energising coming to work and getting exposure to these long-term aged care employees, because the work that they do is inspiring.
Yeah.
Right? And coming in, and that's what energises me, because these people come to work to look after our clients and residents every day. Right, and that's I'm not looking directly after someone, but I look at a role like mine as my role is to look after them so that they can look after the people that really need it.
And then also so that when we're ready, the industry is going to be in good shape.
Exactly.
What's exciting you over the next 12 months? Let's start with Mercy Health, and then we'll talk about aged care in general.
Yep, absolutely. So what are we, June? It's almost a new financial year. New financial year means new money,
Yes.
right? Which is always exciting. We, as I said, created our strategy last year, and we're working through now. This is the first full financial year with the new strategy. So we've got some really exciting areas of focus that we've got. So we're going to start to focus a little bit more on innovation. We're going to really start to focus on experience. We're really going to start to focus on improving some of our capital work, so our building. So we've got, as I said, 30 aged care homes around the country. We've got a number of them that are getting old, right? Call a spade, they're getting old, and they're ready for their next stage and phase of life. So we've got some, as an example, Rosebud down in the Mornington Peninsula in Victoria. It's a 30-bed home. We've got plans to turn that into 128 beds.
Oh, wow.
And co-locate it and turn it into a precinct with, I think last check was 60 retirement living units on site. And so then what we'll have there eventually, and that's not this next 12 months, but we're going to start this process in the next 12 months, is to then have a precinct, which is something that we're really focused on. So all on the one site. You've got home care, right, for people as they start to enter that ageing journey. Then as their needs change, they can consider moving into a retirement village, right? That retirement village, without having to move, could then become assisted living, right? So they could then have meals provided for them on a daily basis. They can have someone, a nurse call button on the wall or a pendant if they need, and someone's on site that can come and help them if they've had a fall or whatever it may be. We'll start to look at technology and how that can help monitor, not in a Big Brother style, but from a quality and safety perspective, with consent, obviously, to look after them and make sure that they're safe, right? And then as their needs then change, if they have gone through that full cycle, they'll potentially have built friendships and relationships with staff, with other residents and people that live there, and then they can move in to the residential aged care in our household living model. So rather than the traditional style of long corridors and very institutionalised aged care homes, we're looking at households, 12 to 16 beds with a shared living area, a shared kitchen, a shared dining area, and consistent staffing, right, where they're not living just in their room, right? They're living in a household with a shared space. And that comes with its challenges.
Yeah.
It's not for everyone, right? But the experience that we hear and see from residents and their family members in these settings is just awesome. I love it. And when you walk in, you don't feel like you're walking into an aged care facility.
No.
You feel like you're walking into a home, and I think that is a really important thing. So starting to build towards that is a big area of focus for us. We've got some exciting things that we want to do, as I said, in that experience lens. We want to use technology more. We want to make our staff's life easier. We want to create a better experience for residents throughout their entire journey. So you'll note I just spoke about the journey of clients into residents starting from home care through retirement living. into residential aged care, what I'd love is to have an app that follows them through that, right? So technology that enables clients have what I call liquid experiences. They come in and I can do this with Uber, I can do that with Amazon. It uses AI, it uses technology. And people expect that from their service providers across home care or medicine. And starting to think around and look at what other industries are doing, right? Not in care delivery, not in home care, not in aged care, not in any of these things. What are just good, cool, big companies doing? And what can we learn from them and bring to people as they get older, as they become more technology literate?
Have you seen any apps that do that, or are you developing something in-house?
Yes, we've got a healthy aging app, so we've got a partner in that space that we do partner with. And we use that in our home care space at the moment. We're about to start in the new financial year some broader conversations in that idea that I've just shared with you. That's an idea, right?
Yeah.
That's what I want to kind of move towards. We've got to go and test it. We've got to go and build it. We've got to go and work out, does it actually work, and is it something that clients and residents actually want?
Yeah.
Is it viable and is it possible, right? But I think something like that's really, really important.
Yeah. And as we transition to the next question, where I ask you what's exciting about aged care, I do want to get that message across that one of the things I love and I'm excited for people outside of aged care to know, and you know, everyone knows about AI and technology, robots and all of that. What you mentioned about the group homes experience, aged care is moving away from that traditional institutionalized, you know, 1 million beds in a institution. Even though there are some, I guess there are some providers who are building like a 150, 200 bed facilities, they're still building it like a home, like an apartment. So I don't think the general public, when the general public think of aged care and nursing homes, they're still thinking about an institution. But it's happening. It's already happening. We're shifting away from that. So I'm really glad that you shared that about Mercy Health. What else is exciting you about aged care?
I think that we are there's a nexus that was supposed to be happening imminently in the next week or so. It's been delayed slightly in the new Aged Care Act coming in the 1st of November and the improved quality standards that go with it. I think it's important. It's not without its challenges, and I think a change in policy settings can be good in that it can force transformation. I think providers, and particularly in an industry where there's care and there's someone that needs to be looked after that's vulnerable, is at the core of our business, is why my business exists. It's why lots of these businesses exist, all of these businesses, I hope. We have to remember that change takes time. Change is really difficult. But I like the difficult problems. It's why I come to work. It's why I love my job. So I look at the new Aged Care Act, and with the timing that we've now got and a bit more time up everyone's sleeves, everyone has, over the last few weeks since the announcement, I think collectively taken a breath. But now is the time that providers should be putting their head down and really focusing on the 1st of November and what comes. I think from a home care perspective, it's going to be a really interesting time. I'm nervous for really small providers that don't do a lot of clinical care. Their business and financial model is scary in the new support at home model. Businesses that have a really strong foundation and a clinical offering are in a better position. But the dynamic changes. Rightly or wrongly, support at home is aligned and moving towards the NDIS style of policy. And that's okay, right? We know about that, as long as we don't make all the same mistakes, right? To be honest, we can move towards that model, we just can't make the same mistakes. I think that this is a once in a generation reform, and if we do see the same mistakes being made, I think everyone's let themselves down. And it's not about pointing the finger and the blame game, right? I think that the government was ambitious with the timeline that they had. That's okay, ambition's good, right? They've realised that they were overly ambitious, and as I said, I think they realised that there is someone at the end of the line that it's important that is looked looked after. So yeah, I think it's a really exciting time, 1st of November, and all of the improved quality standards, right? It's a good thing. Moving to a different compliance model and a different registration model. There's 80,000 home care packages nationally that are going to be released with the new funding model, right? So there's lots of really positive things that are coming, and there's just so much to be excited about.
I shared with a few people in my network that I was having you on the podcast, and they sent me a few questions to ask you, if you wouldn't mind tackling them.
Yeah, of course.
So when we talk about so this question is from Julie Hogarth-Williams, the CEO of the Seniors Channel. When we talk about the residents' digital experience, much of the focus is on clinical apps or family communication portals. So I recently interviewed Julie, and her passion is actually in the area of interactive engagement to combat social isolation. How does a focus on joy, community, and active entertainment fit into Mercy Health's broader strategy for healthy aging?
Yeah, it's a really good question. I think you can look at it through both a digital or a non-digital lens, right? So as I touched on before with the idea around the app that we've got and how we can use technology to improve someone's experience, I think the joy component is something that's often forgotten about. And I think a lot of the stigma for a lot of people is in that traditional style of residential aged care, feeling like they're being locked in a room, they don't know anyone, they haven't got that sense of community. For those that do have family or friends that are technology literate, the idea of having digital games or other kind of on-site activities where people can come and engage and have that community is really important. And so I think it's actually absolutely an area of where I don't think any provider, from what I've seen, is actually doing anything amazing in this space. And it's certainly something that through this app that we're really planning to focus on is all elements of the resident experience, right? You can think about the fundamental basic operational things like billing, right? Like care plans, important, right? But basics. Right, let's start to talk around the cool things, the important things that actually make a difference. How can we use technology and AI on a phone, in a device, in a room? How can we use that to improve the experience and remove the feelings of isolation and loneliness? How can we use technology to take care staff away from administrative, burdensome, really time-consuming tasks and use technology to do that, so they can spend more time doing what they're actually being paid to do, which is to look after and care for a resident. Yeah. These are the kinds of things, and there is no panacea, right? There is no silver bullet, there is no just, here's the solution. But I think that there are certainly some ideas that people have in this space, like there's this cool robot that exists that uses AI that residents can talk to. It talks in all different languages as well, so it's kind of a one-size-fits-all solution. And it uses AI to build a relationship with this resident or person over time.
Are we talking about Abby, the robot from Andromeda?
Yep. So that's an example.
I'm a big fan.
Yep, right. So things like that, I think it's about getting the buy-in from residents, and I think we're right at the cusp of technology or technological literacy, right? So residents of past years haven't grown up with technology, and we're not going to see residents for quite some time that have genuinely grown up from a young age with technology. But we're starting to see now more and more residents and clients come through that have had technology be a bigger part of their lives. Yeah. And so they're far more open to this. And so the question that you ask is really important, because the expectations that these people are coming into care with now are to be able to have community and joy and connection, and providers should be working to facilitate.
Yeah. The next question is from Dane Mitchell, Managing Director of Optimum Allied Health. They provide physiotherapy and allied health services to aged care providers. So from your strategic viewpoint as a major provider like Mercy Health, how do you quantify the return on investment of allied health services beyond the direct funding impact, and how do you embed that value into your long-term strategy for both resident well-being and organisational sustainability?
Yeah, it's a good question. It's really important. And allied health is often something that gets overlooked. It is, there's a mandatory element to it. Providers are funded to provide what is clinically required from an allied health perspective. There's then the ability for providers to provide additional services or the higher everyday living fee in the new terms and allied health and forms of that outside of the clinically necessary component is something that a lot of providers look at and provide currently. I think the idea of reablement is something that's really important, right? There's one thing to have maintenance, another thing to have reablement. So when you start to have a look at fall rates in residential aged care facilities, and even for those that are getting older still at home, right, there's a real need to use allied health providers to help remove or reduce the risk of falls, to do your falls risk assessment tests and other things like that, to really look after and ensure that people, as we call it at Mercy Health, age healthy aging, right? So I think you need not only what is clinically necessary, but also the people that like to go to the gym and want to be able to be provided with those services and do a personal training session if they so choose to, right? Having options available, I think is really important. So from a return on investment perspective, I think finding a really good partner, I'm really big on partnerships. Finding a really good partner in that space is important. So someone that can not only provide you with the services that you have to provide through core services, but also can offer reablement and other activities and classes, and can look at the best of breed options and come with the desire to support your residents in that residential aged care facility setting, I think is super important, and there's a huge amount of opportunity, I think, for a number of providers to do more in that space.
I'd just say you nailed that question.
Thank you.
Like, I can't believe you've only been in aged care for 18 months. And when you said you went and spoke to every part of the business, I 100% believe you. I didn't doubt it before, but like that you drove that home, because you speak like you've been in aged care and for forever. And these are not small issues that you're talking about.
Yeah, I love my job. I love my job. Yeah. I'm a workaholic.
That's why I was smiling so much as you were answering. I was thinking, holy, I was about to swear. We can beep that out if I did. But yeah, sorry, I'm just having a fanboy moment over your passion for it and your dedication to learning about every part of the industry. So thank you.
No, thank you. It's a lovely thing to have said, and I probably won't work in aged care forever, right? And as I said at the start, this is a really important place for me to spend some time in my career, to try and have as big of an impact as I can. And it's not about me having an impact. It's about me being able to do some really cool things and help some people along the way to do some learning. And if there's some good that comes out of it as well even better.
Let me move on to the next question before I ask you for an autograph. I'm having the fanboy moment. All right, so this next question is from Nilesh Bansal, the principal and founder at Aurelia Legal. He's an immigration lawyer, helps specialize in the 482, 186 visa sponsorships. So when your team models the financials of workforce strategy, you're essentially weighing a significant upfront investment in a sponsored employee versus the higher ongoing hourly cost of a flexible agency worker. Has your analysis been able to pinpoint a typical payback period? Or in other words, how many months does that initial investment in visa and relocation costs effectively break even?
It's a really good question. I've actually had some experience in this quite recently. There was background for you. I said we've got a growth priority. We acquired 2 aged care homes at the end of last year, and there was quite a contingent number of staff that were all on sponsorships, and so we had to go through that process. So I've seen the costs that goes with it, from the lawyers, from the government with the visa fees and everything else like that. So it's a really complex issue and it's a really complex area. So if you don't mind, I might talk about that a little bit before I answer that question. So I think the policy settings that we have in this country are really important from an immigration perspective. I am very pro immigration, because we have, as we said before, we've got this aging population. We've got more older people than we've ever had before, and that will be true tomorrow and the day after and next week and next month and every year for the foreseeable future. So we've got no shortage of older people that need care. Conversely, we've got fewer and fewer and fewer people that are wanting to work in this space. It's a real problem. We've got more than ever people that need care. It's harder than ever to get staff to look after these more and more older people. We're not going to have enough beds, right? So there's already going to be, challenges there from not enough beds to look after people as they need care, not enough people to support the beds that we do have. So you're then pushed into different settings, so retirement villages and home care and everything else like that. It's a real problem and there's no simple solution to it. And I think migration is one of the solutions that we do have, and incentivising people from overseas that do want to work in this industry, that are passionate to come and care for people, that want to bring their families and their parents and everything else with them. Wonderful, great, right? I think there's so much more that we could be doing as providers, as an industry, as a country. We've got this problem, we know about it, we talk about it, no one's really doing anything, honestly. There's some really wonderful initiatives like the Palm Initiative, where we're bringing carers from the Pacific Islands over to come and work, and it is expensive. And so I guess to arrive at the point where that context I think is important, to your question is, agency workforce is really expensive, but it also has a place. You're always going to need some kind of bank nurse or agency staff across your aged care home and your home care workforce, in fact, because we are humans and we do get sick and life does come up and people take holidays, right? That's a perfectly normal part of life. I think where you then have a reliance consistently in the same place or same region or same home to use these kinds of staff is where you have a problem. And the return on investment then, so I think the first point is where you are consistently using agency staff, you've got to try and do something about it. You've got to go and find a good recruitment partner. You've got to go and find the right organisations and approaches to solve this problem. If you then can't, right, you then would look to bring people from overseas through a sponsorship kind of program overseas, and yes, to the country. And yes, it is expensive, but the return on investment, if you are in a position where you are constantly using agency staff, I would say it's probably in the 3 to 6 month mark, depending on where and a number of given criteria, but the return on investment is actually pretty quick, and often a lot of conditions of sponsorship is that someone retains with the employer for 12, 18, 24 months minimum, whatever it may be, and so you're guaranteed that return on investment in effect. Things do happen, right? Life gets in the way, but absolutely, I think any providers that are out there that are consistently using agency staff at the same place for the same role, and it's effectively the same person, they really should be considering this approach. It's not the solution, but it's one solution.
Love that answer. Nailed that one too. I want to take a moment to thank Accolade and the Healthcare Channel for inviting me to co-host and collaborate on the podcast. So this is the joint Pioneers in Aged Care podcast and Healthcare Channel podcast. What's your experience been at the event so far?
It's awesome. It's always great to come to conferences like this and spend some time with peers and competitors and vendors. I've just, prior to us starting this podcast, I was just speaking on a panel. And one of the things that we were talking about there, which was of a technology focus, and what we were talking about is lots of providers in this space are at different parts of what I would call maturity. Right, there are some really, really mature and leading organisations doing some really cool things, and there's lots that aren't. Right, and I don't just mean the small providers. There are lots of big providers that aren't that innovative or aren't that mature, and that's okay. We've got to talk about it and remove that stigma of where we're supposed to be and acknowledge where we are and how we get to where we want to go in the future. And I think one of the benefits of coming to conferences like this in this industry, in the context of we've got an ageing population, we haven't got enough staff. We might be competitors, but we're actually not, because there's going to be too many clients and too many residents for us to be able to service. There's not going to be enough staff, right? So we might as well work together and try and make the industry better for everyone, and work together so that people get looked after, so that staff can have the best possible experience, and at the end of the day we can all do something important together.
And now can we share a bit about something a little bit about yourself? Just
Sure.
so when, because again, the title, it's a mouthful, sometimes intimidating, But you come across as a very approachable, warm, friendly guy. So there's probably not an issue with approaching you and talking about aged care and stuff. But if we did approaching, we didn't talk about work and aged care, even though you're a workaholic. What would we be talking about?
Well, I've gone into the football, so I live down in Melbourne. I love sports of all kinds. I'm a very bad golfer, like really bad.
You're a bad what?
Very bad golfer, like really, really bad. So I'm trying to work on that on the weekends. It's been a bit wet and cold.
When you say bad, can we quantify that? You want to quantify with a number?
I don't even want to quantify that. It's a bad number. So that's probably what I kind of am currently focused on. I love music. I love all types of music. I've got an awesome record collection at home that I love
records, actual records,
actual vinyl. Yeah. Both new and old. Dad recently gave me his old entire vinyl collection, which is awesome.
So you have them displayed at home.
I've got a good, really lovely little setup. For some of them, there's too many now that he's given me, lucky me, to be able to display them all. So I've got to work out what to do with that. But what I've been doing recently on a Sunday afternoon is, just going about my Sunday relaxing. I'll chuck one of his records on that I probably don't recognise and just listen to it, and then I talk to him about it.
But why records? I understand. So if I was to get into it, there's probably the novelty, the feel, like physically putting it on and then putting down the pin. Yep. I mean, there's something about that appeals to me. Is there more to that? Is it the sound?
Yeah, there's the cathartic experience that you've just described. Absolutely. I think I love all types of music, and I think something that's changed, maybe for the better, maybe for the worse. You be the judge. With technology over time, is that we've got this instant gratification and this ability to go from this to that to the next thing. You look at Spotify or whatever your channel of choice is, and you can move around.
Yeah.
Musicians are artists. They've typically written an album in order for a reason, and we often miss out on that story and the story that they want to tell and the journey they want to take you on by only listening to part of it, and that's okay. But what I love about it on that Sunday afternoon is sitting down and listening to the story that someone wants to tell through music and the words that they've written and everything else. And I also love my wine, so I'll often sit down and crack a bottle of wine and have a glass or two and just sit and listen.
Your Sunday sounds amazing. Sit down with your music and some wine. Daniel, I think you should start a podcast. I could listen to you talk all day. But honestly, thank you so much for jumping on the podcast. Really appreciate it. Loved having you on. Thank you.
No, thank you. Thank you for the invite. Lovely to meet you.
Cheers.